Okay, there we're on. We're on.
I want to finish up the last talk, in which I did not mention the implications of the two models, the environmental model versus the genetic model, and the critical importance that the implications have on how society deals with addictions and addicts. Put in a very simple context, the implications of the environmental model are all moral implications, where the addict is blamed for causing his own addiction by a conscious and willful and voluntary use of the drug to begin with, and then the drug changes the brain into an addicted brain. Even addicts see themselves as moral failures and as bad people because it's because of that model. And judge themselves and punish themselves. In fact, some addictions are totally about punishing. The addictions that are currently labeled eating disorders are totally punishment addictions. And the symptoms of those addictions tend to be hurtful in totality. One of the reasons why they're not considered addictions by many people, because they have mostly hurtful consequences. The genetic model, however, makes it perfectly obvious that addictions aren't voluntary, and removes the moralistic consequences of addictions from the patient, from the addict. It's a critical part of that it's a critical part of the genetic theory that the addict is not held responsible for causing his own addictions. Some people are against that simply because they fear that it lets the addict off the hook. The addict can no longer be held accountable for the addiction per se. I don't know why addicts have to be held responsible, but even in the genetic model, we hold the addict responsible for his recovery, despite the fact that he didn't cause his own addiction. We hold addicts responsible for criminal behavior. Making sure that we define the criminal behavior based on actually hurting another person. We don't hold addictions to be criminal behaviors on their own. The importance of the implications are that in modern medicine, as opposed to the medicine of the Dark Ages where superstition reigned, in modern medicine, the theory of causation, the scientific theory of causation, leads to three things: a prevention modality, a treatment modality, and a public policy determination. That's the importance of the implications being correct. And only the genetic model will eventually be shown to be related to prevention, treatment, and public policy that works. The environmental model has led to zero prevention, 5% long-term recovery, and public policies that are totally hurtful to the population at large as well as the addict population. The genetic model has completely opposite implications from the hijacked brain hypothesis, where the prevention is the primary implication. Because in our model, we start people on recovery programs when they're diagnosed with hypoism. They don't have to wait until they're addicts. We can start people when they're diagnosed with ADHD, because the ADHD is a subgroup of hypoism, a large subgroup, maybe 80% of hypoics will start out as being diagnosed as ADHD or ADD. And it's already been proven that those diagnoses are genetic and are based on low activity of the reward system. Dr. Vokow and Dr. Wang showed that in 2009. The implications of the genetic model are basically that we can eventually expect 100% prevention. As opposed to 0% prevention today. We can expect a much smaller group of active addicts that we then have to use the same modality to allow for treatment. We use the same method. The treatment method is the same in both prevention and in recovery. Public policies come right out of the genetic model as well, allowing for the discontinuation of the drug war because the drug is no longer held responsible for causation. We end the drug war. We let all the addicts out of prison, and we focus on their recovery rather than on their punishment.